Hi everyone, I'm Ali GREYMOND. I'm continuing to answer the questions that you asked about OCD recovery. And first question today is, Ali, how do you deal with the fear that after I recover, I will become my OCD thoughts? Example, HOCD or our OCD in terms of fearing not loving my partner anymore. It's something that used to set me back really badly, and I would appreciate the insight. First of all, these thoughts are extremely normal. They are classic OCD thoughts, So you have to look at it that if, all the other people dealing with OCD are not falling out of love for real, or are turning gay, or if a person is gay, they're worried about what if I become straight. You know what I mean? Like, if this is not happening en masse, and you're not going to be that first person to whom this has happened, so you just have to look at it that nice try OCD. I'm not buying it. I'm choosing to move on. In terms of you trying to seek proof, because this is the future, right? So you will never be able to prove it to your brain enough for it to let go. And that's why you're not supposed to do reassurance, because you cannot outsmart your own brain. It will always find a rebuttal. It will always find a way to get back in, So you just have to say, nice try, I'm not having this discussion anymore. And you will see that the anxiety will go up because you're not doing anything to reduce it. It will go up, hit a peak. You do nothing, don't engage, and it will drop. And in that moment, right before it drops, it feels, we always talk about with pretty much all the clients, that it has this thought of, this will never go away until I'm 90 years old. And this thought in the moment, when your anxiety is through the roof, it's paralyzing because you feel like this is actually true. This will never, ever go away. And then magically, 30 minutes later, boom, it's down. Not down to a zero, but much lower than it was. Next question is, how do you know if more diverse thoughts coming in is good or bad? I've heard before that when you are close to recovery, the thoughts will target everything because OCD doesn't want to go away. How do you know if this is what it is, or if your OCD is actually getting worse and due to this there's more thoughts? Thanks for all your help. Well, I can just tell from experience, because this is the cycle that I see all the time. And the most important part of this is, generally the thoughts don't last very long, and the anxiety, if we take individual thoughts as they're switching, is not very high. I mean, compared to before, how it was for you or for anybody who's going through it, right? So usually, say for example, the person will get 3-4 times the amount of thoughts that they usually would have, but the anxiety is generally, if it was like a 10, it would be like a 6 or something like that, or a 5 or something like that. So that's what I see normally, and it makes sense, because why would the brain try to send you another thought if you are fully doing compulsions and reassurance for the first one? It'll just keep on the first one. And I've seen cases like that where a person had the same thought for a long time, for decades in some cases, right? So that's your brain doesn't need to shift if you are doing all of the reassurance in the world for it, or all of the compulsions. It'll just send you more of the same thought, But it's when you are starting to actively refuse that, sometimes clients even tell me that they can feel something shifting, how the brain is operating, just something that, like, there's something going on, and how the brain is processing information. I mean, there's no way for me to prove that to you. I can talk from the experience, but it's kind of, you have to be talking to a lot of people to actually see this progression. So you kind of have to trust me that it is true, because honestly, if you look at it objectively, even objectively, it makes sense. Never mind what I'm saying, right? Next question is, hi, Ali, can we recover from religious OCD by ERP and psychotherapy only without taking medications, because my mom doesn't allow me to take medications as they have side effects? So can I fully recover just by doing ERP, counseling, and psychotherapy, or no? To be honest with you, I mean, depending on your situation, but in terms of all this other stuff like counseling, psychotherapy, I don't find them to be very, very effective. I find ERP to be very effective. So, however you're doing therapy, it has to be ERP based. So it has to be around doing exposures. You don't have to necessarily do exposures in sessions, but what you're talking about, it has to be about exposures mostly. If the therapist is taking too much time talking about the past, your childhood, all of this stuff, or getting, so because you're talking about religious OCD, getting into the nuances of religion, trying to sort it out with you, you're going down the wrong path. So you need to do ERP. And if you do ERP, such as how I'm explaining, there's other YouTube channels also saying that the same thing. If you do it properly, you will recover. You don't really need medication to recover from OCD. And doctors who say that you need medication to recover from OCD are just not informed. I've talked to doctors who have OCD themselves. They're not immune from OCD. And OCD is not very common. And again, the biggest problem, not to get into the whole doctor thing, but the way I see it, and again, this is coming from a lot of experience of talking to different people, including nurses, including doctors, you know what I mean? I talk to people probably in every line of work by now. But what I see is the main problem, and this is not a problem just, in Canada or in the States, this is pretty much how it works in most countries, that the doctor only has license to practice in their province or state or what have you, unless sometimes they can get additional licenses and stuff like that. But and a lot of the times, or most of the time, the doctor's office is still not online. It's a brick and mortar place, right? Even if the doctor is a psychologist, right? It's still a brick and mortar place. So who's gonna go there? Well, people in the area. Okay, and then so people in the area, say around maybe a max of an hour drive to that office. If the doctor's really good, the person will drive out to them, right? But a max of an hour drive to them. How many people are going to come to this doctor with OCD, and not just with OCD, but with varied types of OCD? You compare it to any of the OCD coaches, right? Who people come from all around the world because it's through, through the internet, right? And the experience level from coaches to doctors, I mean, there's no comparison, So if a doctor who's seen, say 10 people with OCD once a week has not helped any of them really truly recover, is telling you, well, no, you need medication to recover. I mean, it's with all due respect, you have to look at it that they might not have enough of experience to really make that judgment call, and, I've been in a situation where when I had OCD, I was in front of a doctor telling me that, and they just don't have information, a lot of the times. And, their argument, I hear this argument all the time about, well, you take pills for diabetes. Why can't you take pills for OCD? That's comparing two completely different situations. It's beyond ridiculous. It's silly. Let's put it that way. It's silly. So don't listen to silly doctors. Listen to qualified doctors who are specialists. And specialists will tell you, even if you like Google OCD special, I don't know, you know what I mean? Like if you don't trust me, the coach, but go to a specialist, or just do ERP at home. But if some doctor just tells you, oh, you have to take medication or you will never recover, you don't just have to believe them on their word, because a profession of being a doctor is not any different than any other profession. People make mistakes. They're human. They make mistakes, and it's kind of hard for people to process that, that my doctor can make a mistake. What they're saying, even about medication, even about OCD recovery, may not be correct. you know. But that is the honest truth. You have to be your own advocate. You have to dig for yourself, do your own research, you know. And um, people who are listening to me right now, who are a little bit older and perhaps have been through medical situations, you know, just as, you know, we all go through, know that doctors sometimes don't necessarily say the right things, and you do have to advocate for yourself, and you do have to do your own research, you know. This is just life, you know. So um, I can tell you that I've helped a lot of people recover, and I've seen people come to me on medication and then get off medication because they're better, you know. And they go back to their doctor and they say, hey, I haven't had OCD thought in a while. I don't need this, you know. Or my OCD has decreased by 80%. I really don't need this. I can just finish it up on my own without taking medication. And your mom is absolutely right. There is side effects, you know. Some medications have more, some medications have less, but all medications have side effects, you know. So anyways, not to continue this rant, but she does have a point, and you don't have anything to worry about. Just do ERP all the time. I promise you, if you do this every single day, no matter what, every moment of the day, you will recover, you know. I'm not, you know, and just another kind of thing is, I'm not against medication. I think in certain situations where the person just absolutely, they cannot make a step, you know, seriously, they cannot make a step. In those cases, you kind of need medication just to maybe give the person, you know, max I see at work is maybe like 10%. But sometimes for some people, that 10% is all they need to push through. And if I just felt just a smidge better, you know, that'll be enough for me to do the recovery work, you know. But for most people are already doing work, but it's just, you know, that you need to do more exposures. If you feel like you are trying, you're technically doing the work, you're doing the right things, you're following through with response prevention, but you're not feeling much better, chances are you're just not doing enough exposures throughout the day. So I would say, whatever your theme is, doesn't matter what your theme is, religious OCD, harm OCD, try to do 10 exposures a day. So harm OCD, 10 times you're around knives or whatever it is your thing is, your OCD is telling you, right? Or religious OCD, okay, OCD, tell me all of these scary religious thoughts. Let's go, let's hear them. And OCD tells you, and you're disregarding. Then a little bit later, same thing. You know, really push it. It's pushing on you, so you have to push on it. And again, sorry about to go on the rant, but it's just, you know, when I talk to people, it's apparent that most people think that doctors are these superhuman beings that are all knowing, and it's just not true. You have to be your own advocate. Please tell me if there's a way of telling a difference between a thought and a real memory. If you can accept that it's just a thought, it'd be easier to start the recovery work. How can you tell? Does it feel different if it's a real memory? Okay, I've been doing this for 10 years. I've helped people for 10 years. False memory OCD is very common, because I think when I first started to talk about OCD, I started to talk about false memory OCD a lot. And with that, because that was one of my first videos, I actually have a lot of clients that come to me with false memory OCD. And I can tell you that in 10 years, I've never, ever had a client, even once, for whom it came true. So you will not be the first. So if it feels exactly how you're saying, but what if? What if it's a real memory? What if it's not? Let me try to figure it out. Let me try to analyze. Let me try to remember. Oh, this detail doesn't add up. Or, but this detail seems like it makes sense. And you're going in this loop over and over again. That's OCD. And you need to choose to move forward, even though, and this is where the living with uncertainty comes in. It becomes increasingly less difficult to live with uncertainty as you are continuing to do the work, because you start to see things clearly, because the anxiety goes down. But when the anxiety is through the roof, it's really, really difficult to do any kind of recovery work, or to see clearly. So you just do your best every single moment of the day when the thoughts are coming in, which usually in the beginning they come in all the time, right? Nope, disregarding. Just take that chance. You will not be wrong. Next question is, hi Ali, I have rechecking OCD for many years. Thank you so much, your videos helped me and now I feel much better. Most rechecking had gone, closing the door, putting things on place, but I still recheck data, names, numbers. I'm a tourist agent. Earlier, I checked it for many times, now lesser, only 2-3 times, trying to do my best to check only once. Sometimes I can, sometimes I can't. Can I check once data about my job or must not check at all? My job is very responsible, so I'm scared to make a mistake. What should I do? So I talk to a lot of people in jobs in which they are highly responsible for other people, for other situations, and the rechecking can become a big issue. I would say that rechecking once or just like doing something and then checking it over is fine. I think that's what most people, I mean, I think that's pretty much what everybody does. Oh, let me just double check. That's okay. But it can't be obsessive. It can't be that no matter what, I have to double check every single thing. So try to sometimes check, sometimes not check. Or, but yeah, you're doing fine. What you're saying here, you started out having so many different rechecking habits, and now you're pretty much down to just the 2 or 3. That's nothing compared to what you've already gone through. You just now need to finish this process, but make sure you do finish it, because if you kind of leave it at, well, I just do 2, so it's not really a big deal, it really doesn't take away much from your life. That is true. It is not a big deal, and it doesn't take much away from your life until some sort of a stressor comes in. And when the stressor comes in, you can go to a 10 very quickly and spiral back down. So you need to completely destroy that neural pathway connecting fear and these situations. So it really is 0. So you really don't care anymore at all, and it just kind of not erases from your mind, but just goes away. So and that kind of thing is that's what guarantees your that it won't relapse. Because if you kind of leave a little bit of a strand there, now it becomes like, well, what happens if there is a stressor, so you're doing fine, everything you're doing is correct, but you need to keep pushing as hard as you pushed in the beginning, where you needed to do so much work to recover. Now I find that as people get better, their effort slows down, because it's not as necessary, right? In the beginning, it's like the person's on fire, it's necessary, right? But at the end, it's like, oh, whatever, I'll just do ERP tomorrow, or I'll just check this one thing. Really push as hard as you pushed in the beginning and get this done. Next question is, I'm 30 years old. When I was 13 years old, whenever I would play video games, I had sensorimotor OCD. Now I don't even like to play video games since it's a waste of time. I would rather work to earn financial incentive. My question is, should I purposely play video games to go back to the core of why I had OCD? Or it doesn't matter for my recovery, as I don't like to play video games anymore because I'm now 30 years old. Okay, so you're 30 now. When you were 13, you had sensorimotor OCD. I think it's more so, in this case, the theme is more so about what if I get OCD in the future. That's the real fear, So I would say that I don't want you to be on either end of this, right? I don't want you to avoid video games at all costs, and I also don't want you to play video games as a way to reassure yourself that no, OCD is not going to come back, so like playing them all the time specifically for that purpose. So I would say you can play a video game and say, then if you don't really want to play them, so you don't play for, say, 2 weeks, then you play again, something like that, and try to vary the time so there's no pattern here. So you're just like, say, if your friends were playing a video game and you're like, oh, I remember when I used to play this. So you play for a little bit and then you're like, I don't care, and then you don't play for a few weeks, right? You can't be bullied and pushed into it because of OCD. So it has to be kind of, because both can become a compulsion. I hope you understand what I mean. And now it becomes clear with the second question. Lately I have swallowing OCD. So swallowing OCD is also sensorimotor OCD. So I was gonna say with the first question, that sensorimotor OCD that you had at 13, it must have not gone anywhere, but clearly it has gone to the swallowing OCD because they're basically the same thing. Like I see this all the time from going from these kinds of topics. However, the anxiety is not high as I am in my second month of recovery and I'm feeling a lot better. Good. I have tried to disregard it. However, it's been 3 days now and the swallowing OCD is still there. Am I doing okay? So again, perspective. You've had OCD, sensorimotor OCD, which is the swallowing OCD, since you were 13. You are now 30, right? It went from different topics, whatever, but you've had OCD since then, right? You are now 30. And now you're saying, I have tried to disregard it. However, it's been 3 days and the swallowing OCD is still there. It's going to take a lot more than 3 days and a lot more than 2 months, because how you're saying about the 2 months. It's just going to take more time. You can't be impatient with this. You have to give it time. I would say 6 months to a year. If you're going to continuously look back and think, is it still there? Is it still there? Is it still there? This is anxiety. You're now having anxiety about why is OCD still there, and that is what is going to continue to keep it there. So that and exactly what you're saying. Am I doing too much mental compulsion? That is the compulsion, is trying to figure out what if I get it again? What if this will never go away? All of those things. And what you're saying, as long as I'm not doing mental compulsion, does OCD disappear by itself? Yes, of course. Of course. It's the compulsions that are keeping it there. So in this case, the looking into the future or looking back connected to OCD, So it's just really watch it whenever you're sending it fear in any way. So maybe you're not afraid of the actual the swallowing OCD itself, but you're afraid that in general OCD will never go away. Or what if it gets replaced with another thought? Or what if, right? Like those kinds of things. So just have to say, I'm not answering these questions because it becomes OCD about OCD. I'm not answering these questions. I'm choosing to move on. I'm disregarding and really keep that party line, keep that going, And it's the talking the talk and walking the walk, right? That you are saying that and then you keep refocusing onto other things. You're not allowing yourself rumination. Don't really look up a lot of OCD stuff because I think in this situation, it will be detrimental to your recovery. You already know what you need to do. Clearly, you're doing the work because the OCD the anxiety is going down. But you have to just give it time and sometimes it will help to say, if in a year, I still have thoughts about swallowing, considering how much better you feel in 2 months, it's logical to say that in a year, at most, you will feel better, right? You will recover. So if in the year if I don't feel fully recovered, then I will examine the situation, dig into it deeper, But until then, I'm just going with, if I made progress in 2 months, so say if in 2 months you knocked it down 50%, then in 2 more months you'll knock it the rest of the other 50%, So just keep going, Don't look at it too deeply, just keep going. Every day doing the recovery work. These are all the questions I have for today. I still have more and I will answer them tomorrow. Thank you so much for listening. If you haven't subscribed to this channel, please subscribe. If you would like to do the one-on-one recovery program with me, as always, all the information is on youhelloocd.com. Thank you so much for watching. I'll see you tomorrow.